Okay, so hello everyone. To get us started today, our team would like to start with an acknowledgement of the Indigenous people and the communities whose historical relationships with the land continue to this day, and on those whose traditional territories our work takes place. My name is Sandra. I work at the Canadian Coalition for Green Healthcare as the manager for this 3-year project being undertaken with the financial support of Environment and Climate Change Canada. So on behalf of the coalition, I'd like to welcome you to the Circular Clinical Care Reducing Single-Use Plastics webinar. Today, I'm also joined with my Year 1 pilot advisor, Victoria. She is the Environmental Management Lead at Hamilton Health Sciences. We also have my undergraduate research intern studying at McMaster University. His name is Isaac. And I'm also joined by our researcher from Radboud University, located in the Netherlands, and her name is Yo. So we have a great agenda packed with a lot of content today. So throughout the event, please use the chat function for any technical issues that you may be experiencing, and then use the Q&A function for any questions you have regarding the presentation. And we will be answering the questions at the end. We'll also be recording this presentation, which will automatically be sent to all registrants, and it will also be available on the Coalition's website and YouTube channel at a later time. So with that, I'll let Victoria get us started with the work that Hamilton Health Sciences has done to prepare for the launch of this pilot and to discuss her role as a pilot advisor.
Thanks, Sandra. All right, we'll just start with a screen check first. It's looking good for everyone. Thumbs up.
Looks good.
Okay, great. So my name is Victoria Brzezowski, and as Sandra said, I'm the Environmental Management Lead for Hamilton Health Sciences. I've been with HHS for 8 years in 2 different roles, and my role now is dedicated to advancing and moving forward the environmental performance of the work that we're doing. So I'll start first by just giving some context to what we've been doing over the past number of years, where we're sitting now, and then how we're moving forward with our environmental strategy and how this knits into the plastics project overall. So for some initial context, what you can see here on the screen is what we do as HHS. We're a group of about 18,000 staff, physicians, researchers, and volunteers that provide healthcare services from birth to end of life within the Hamilton region. If you're not familiar with the Hamilton region, I've kind of pulled a map for you so you can geographically orientate yourself. We're within Southern Ontario and nestled kind of between 2 lakes. And we do have the majority of our hospital and ancillary sites located within Hamilton, and also one of our hospital sites in Grimsby, which is in the Niagara region. So our stewardship or environmental sustainability journey has been ongoing for a number of years. The primary driver has been regulation, and all of the extra nice to haves have been done off the side of our desk. And this was kind of really the case up until 2017. Mainly we're motivated by regulations as they were mandated towards reporting and mitigating our scope 1 and 2 greenhouse gases, doing a lot of work with waste management, so managing all types of waste throughout our system, from biomedical to regular waste to organics, and then participating in some voluntary efforts such as the Green Hospital Scorecard. I think we're an original reporting hospital with that, and then promoting staff-led initiatives like carpooling. Since 2017, we really started enhancing the work that we've been doing and committing to doing more reporting and really trying to move that work from the side of the desk kind of into the middle, from the periphery into the middle of the work that we're doing, and really trying to knit it into our core mandate as an organization. And so that looked like introducing new roles. So we introduced a new building automation system coordinator, adding resources to our facilities team for energy management, and investing significantly into upgrades and retrofits. So a huge, multi-million-dollar upgrade that we made to our energy, so our our cogeneration system allowed us to reduce emissions by, which is now, it says there on the screen, 48%, but it's now more like 50% reduction since our baseline year in 2016. And we committed to that accountability and doing all of our reporting and publishing it on our website, which we have those historic reports there if you're interested in having a look. So where that's led us is to the position we're at now, and that acknowledgement that, healthcare really is a huge polluter when it comes to emissions, and also physical waste as well. That healthcare is responsible for 5% of all of global emissions, which is more than the airline industry. So with that recognition, we, in a refresh of our strategic plan, added environmental management as a strategic project. And we divvied up that work into the 3 categories that you can see on your screen there. I'm responsible for those last 2 of those work streams. So that is to conduct a scope 3 greenhouse gas inventory, and also take care of that everything else. So not everything has a greenhouse gas impact. Well, at some point it does, but that's not really always what we're looking for when we're creating a stewardship plan overall, such as why we're all here today is to talk about the plastics piece about that. And so that's the work we've been doing really over the last year. And if you put that, into there we are. So what we've been doing is we've engaged in specifically my work, as well as advancing the work in that scope 1 and 2 to kind of find and define a plan for where we want to be by 2050, is that we have conducted the greenhouse gas inventory and done a ton of stakeholder engagement to really figure out what matters to people. And the goal of that is to mesh the science with the facts with what people care about to develop our plan for our next steps forward. And so, like I said, that's been run in 2 phases. Phase 1 is to conduct that inventory, and phase 2 is to do that stakeholder engagement, that environmental scan, to figure out where does this all make sense and how do we kind of make a plan that is meaningful to our stakeholders and one that we can actually make happen. So to highlight some findings, and none of this is published yet, so you guys are, I guess, a rare group in seeing some of this data, is that scope 3 greenhouse gas inventory that is almost completed in terms of our reporting and our recommendations that are going to come forward from that, is highlighted to us, again, not a huge surprise in the percentage, but that our scope 3 emissions account for 75% of all of our total emissions. From like an overall impact point of view, those emissions amount to over 130,000 tons of carbon dioxide equivalent. So kind of putting that into perspective, that is about over 90,000 transatlantic flights and 30,000 kilometers commuted, the equivalent of 30,000 cars commuting each year. If we split that out, and I'll just take you back to the previous slide, by the categories in which we inventoried, there were some surprises. So again, the percentage overall wasn't a huge surprise, but the categories in which those impacts were occurring was surprising to us. It's kind of hard to see on your screen here, but if we looked at them all in their own different buckets, what you'll see there is it's the 4th bar on the screen, that's food. So that next to natural gas, which is your 1st bar, is food is the single highest category of overall emissions that we create. Next to natural gas as an organization. That's not food waste, that is the food that we feed to our patients. So as we're developing our plan, it's very clear to us that we need to look at that category. What's also really clear, and what is relevant to the work that we're talking about today, is where the other impacts are occurring. And that's in the materials and products that we procure, and then also how we dispose of them. So that starts to get into this conversation more about, like, what is it that we're purchasing? How can we reduce plastics in those strategies? And then how do we reduce overall the materials that are being sent to the landfill, so we're not even creating an emissions downstream, it's being put back and contributing to a more circular economy. If you split it up by hospital sites, which is the slide we were on previously, you can see our 3 hospitals here that have the largest impacts are our acute care sites. And so each of those sites range in their beds between 400 and 500 beds. And you can see our smaller sites there. St. Peter's Hospital is a long-term care hospital, and West Lincoln is a community-based 50-bed hospital. So that gives you a bit of a point of reference to see maybe where your organization fits in all of this and where the highest emissions happen. Again, intuitively, it's going to happen at the hospital sites where we provide the most care. I've chosen to highlight two of those bars in more detail so you can see how we've broken out the categories themselves. So in this category of purchase goods and materials, we have broken that out into different streams. So this is where we would find, all of our equipment, our pharmaceuticals, all of our med surge supplies, all of the, some of the food that it falls into this category as well, and drugs, medical gases, all of that. So a lot of this sort of plastics that we are using as an organization falls into this. And as a single category, it amounts to 76% of all of those scope 3 emissions. So this is the biggest bucket where we need to address our overall emissions and create meaningful strategies to reduce our environmental impact. In contrast, and I wanted to highlight this too, when it comes to downstream waste emissions for us as an organization is actually only 1% of all of our emissions. So the true value in our work is reducing and changing what's coming into our facilities. That's going to have the biggest impact rather than managing that downstream. Again, there are other impacts aside from emissions that are really important to environmental strategy, but it is not from an emissions point of view. Waste isn't that impactful. It's really what we're bringing in. So the journey we've been on, we've been doing this stakeholder engagement. So that's what the data says. So that's the quantitative stuff. What is the qualitative stuff? So we've engaged a number of stakeholders to figure out, okay, this is what the data says. What do you guys actually care about? And how can we make these things blend into a plan? And that's highlighted a few, when we kind of mesh those two phases together, highlighted 4 really clear buckets of work that we know people care about, and then the data says is really important for us to address. You can see those on the screen, and very at the top of every single one, it was that waste reduction and materials management. So again, thinking about the plastics, very, very top of mind for folks, and the data really shows that we need to do a lot of work there as well. And so right now, what I'm currently working on and fleshing out is this plan forward. What are our plan pillars? Where do we want to focus our energy and time? And so we split it out into what you see there on the screen, with the plastics piece really factoring into that first one there, and then also having some touch points when it gets to accountability and leadership as well. So if we expand that out, our plan that we're developing is really designed to have very clear targets, very clear outcomes, objectives, and deliverables as well. So looking at that, a target, and this is one example here, again, we're not fixed in this yet, we haven't released the plan, is to achieve a 60% waste reduction. And the plastics project really starts to come into play here when we look at the strategies under that target. So if our outcome here, outcome C, as you see on the screen, is to reduce use of single-use plastics. And again, 20% is probably not ambitious enough, but that's the number that's on the screen right now. How we're going to do that, the strategies we're going to take to actually start to move that needle, we're looking at a number of ways to approach that. So that is to increase the use of rebuilt medical devices, or reprocessed devices is another way to call them, and reduce the amount of single-use plastic, specifically in nutrition services. We know through waste audits and through stakeholder feedback that that's an area that we really need to address. And so it's starting to put together, here's a target, how are we even going to start to, take a bite at this, right? Because it's a huge thing to accomplish. Create this plan and really start to measure in small incremental ways have small measurements that feed into this larger, 5-year strategy to reduce and improve our waste diversion, for example. That is really how we're trying to approach this. And so with my role in this plastics project, and I'm so excited to have been be the year 1 partner hospital for this, is to advise, so really bounce ideas off of Sandra and the team there to say, hey, what are you guys thinking about? What does the research say? Oh, this is how we could make this practically apply to HHS, and this is where we see the value for us as in an organization, and then really help to network that through our organization. We have the benefit of being a multi-site hospital as well, which offers different types of patient care. So that means, we have the ability to trial a process at maybe an acute care site, and then really think through the nuances as how would this actually apply to different settings, and is this process that we're conceiving of able to be duplicated and transfer along. And the value of that is that what we're hoping for in the end is that we create strategies and guidelines that really are transferable to a lot of different types of healthcare settings. And I always have my mind to that as well. We also are a major player in with our local group purchasing agent. So we have a lot of ability to collaborate at that level and try to navigate those bigger conversations we might need to have about a policy as it relates to procurement. And so my role is to really help Sandra and the team navigate all of that within this big system, while at the same time mutually benefiting from the work that's being undertaken here to drive and measure. At the same time, the work that we've done to measure our Scope 3 greenhouse gases is going to be an added value to the project, because we can feed that back in, use a template that we've been provided to measure and track the success of our projects, our reduction projects, and feed that back into the data set as well that Sandra is going to be gathering. So I've tried to keep it really short. There's a lot more there, but I'll hand it back to Sandra, and then we'll do questions at the end, like Sandra said.
Yeah, so thank you, Victoria. So that is what led to the collaboration on our pilot, and this is how the coalition steps in. The Circular Clinical Care Single-Use Plastic Reduction Project has launched with the financial support from Environment and Climate Change Canada. And the coalition has started by establishing this core interdisciplinary team that is committed to sustainably reducing single-use plastic waste in clinical spaces. And so our team is continuously growing, and it's starting with members from our project partners at Hamilton Health Sciences, at McMaster University Postgraduate Medical Education, and Peach, Ontario. And so having an interdisciplinary team that is continuously growing with more and more people joining with their diverse skill sets is a key strategy that is allowing us to start strong with our year one pilot at HHS. And it's going to help us transition into a national campaign during year two, and then ensure a successful full national campaign in year three. And so this is also important because there's so many ways that we can reduce single-use plastics in healthcare. And some of the ways that we are tackling the problem is through innovation in terms of research and developing maintenance programs for the plastic reduction interventions that we are implementing. Clinically, we are there on the ground to support capacity building among staff and postgraduate medical residents that are in training. On the managerial side, we are identifying leadership to further help build healthcare worker capacity. And then we are bringing what we are learning to a national healthcare campaign that will go coast to coast. So this project has multiple dimensions. However, we have three core pillars that are foundational, and they ground the work that we do to maintain cohesion among the different aspects and help ensure that we are making strategic decisions that maximize our impact. So naturally, our first pillar is sustainability, which is our ultimate goal is something that we all share here, which is that we just want to be able to promote the social responsibility of healthcare institutions through environmental stewardship. And to do that, we need a collective agreement. And so people is another pillar. We try to support people by building individual and organizational capacity to not only have the motivation, but also the skill sets and confidence to participate in these initiatives, and then actually be able to implement green health policies and practices. And third, you know what they say, you measure what you treasure, and we really treasure our work that we're doing. So research is another pillar. We are measuring the impact of initiatives, as Victoria was mentioning, and as a part of this project so that we can further help build resilient healthcare infrastructure across Canada. And we are doing it based on strong data collection methods and the integration of statistical analyses when possible. So these are our third pillars of our project. And of course, we want to be able to do the work to support our own Canadian society. But at the same time, it's also a way that we are trying to support planetary health and further the UN Sustainable Development Goals. Specifically, when we're looking at the indicators and the targets for this project, it's going to help further goals 9, 11, 12, 13, 15, and 17. So now looking closer at the clinical care project itself, we have 4 project categories that the initiatives we are developing will fall under. We have perioperative care, packaging specifically related to pharmacy, hospital textiles, and food and cafeteria services. Now, these are 4 different categories with their own goals, their own initiatives, and each initiative has its own like core project team. But we have strategies for implementation that are standard. So each initiative is going to have its own standardized workflow procedures to allow reproducibility of initiatives in the national campaign and ensure that before an institution commits to implementing an intervention, they are aware of what are the infrastructure needs and the commitments needed to actually be able to proceed. The second strategy we use is that we have consultation meetings with the clinical staff, non-clinical staff, managerial staff, learners, volunteers, even with established groups that range from advisory councils to meetings with people from formal associations. And this is all done to help ensure that initiatives are designed to be structurally resilient. So that leads to coordinated task delegation and collaborations where interdisciplinary collaboration really shines here because this strategy allows individuals to work in high-performing teams where the members complement each other by leveraging their skills and participating in specific tasks that they are passionate and motivated to do without overly extensive time commitments on an individual level. But the collective time that is spent on a project by the group is still very high. And so ultimately that allows impact that is more synergistic rather than just additive. And lastly, the final piece of the strategy is maintaining accountability to the organizational structure and pillars. And so over the past 4 months that I have been working on this project, this is exactly what we have been applying when we are looking at perioperative care. So the projects related to perioperative care are those that are related to reducing single-use plastics before, during, and after surgery. So one project that falls under that is the postgraduate medical education project, where the goal is to switch from using sterile water that comes in plastic bottles and use tap water instead during endoscopy. And this is because the research shows that it is just as safe, and there are some clinics where tap water is the common practice in Canada. So we are currently at the point of testing tap water samples at HHS locations. And this core team consists of myself, who has a global health background, Victoria, the environmental management lead, a gastroenterologist, and a surgical medical resident. Another project under perioperative care is a quality improvement project trying to implement a more prominent bring your own bag campaign for patients that are coming in for day surgery. And this is where our researcher Yule will provide a lot more details for. We are also collaborating with HHS's medical device reprocessing department to identify opportunities for reprocessing medical instruments. So currently we are making a list of what HHS's MDRD department is reprocessing internally and what is being processed externally. And organizations that are interested in being a part of this national campaign will also be asked to provide this kind of list so that we can establish a baseline of commonly reprocessed medical devices across Canada. And finally, we're collaborating with procurement groups like the internal procurement group at HHS. We are talking to Mohawk MedBuy, Supply Ontario, and even the bi-monthly sustainable procurement group organized by the coalition, groups like that to help explore other alternative products that are not single use for periop. So we started by focusing on perioperative care at HHS to launch the pilot. And now we're starting to explore ideas for initiatives related to the other categories. So some examples of projects for pharmacy is switching from putting medication into glass bottles instead of plastic bottles. And this is an idea that was proposed to me by the Pharmacy Association of Nova Scotia. Another project that would fit under the scope of packaging is creating prepared kits of certain medications called like combination meds for ease of nursing administration. And this idea was inspired by Carillon Clinic that has been successful with this project. And switching to textiles, an example of that would be bundling linens, which is an initiative done at South Lake Health in Newmarket, Ontario, where the patients are kept warm by using a flannel blanket first and then a sheet on top, so that the bundle provides layers to like keep the patient warm, but is also very effective at avoiding waste. And finally, a project under the food and cafeteria scope is to have, for example, a reusable water pitchers for inpatients that are stored on floor kitchenettes where nurses or the aides can fill the cups for the patients. And then once the pitcher is done, it gets taken by nutrition services and a new one is brought in. So there is no refilling involved. And this is inspired by the Lawrence General Hospital, where they have found the pitchers themselves to be very successful. The challenge actually lies more within the cups. So that is something that would be within the scope. And outside of creating project plans, I'm also collaborating with a knowledge translation consultant to design training modules for successful project implementation. We have developed a generalized framework for the business cases and the case studies that we are pursuing. The content I can't share yet, but there will be 4 case studies and 3 business cases that are going to be related to the 4 categories of this overall project. In addition, the coalition has been preparing to start an ethics application for a national study that essentially looks to identify and understand the barriers experienced by clinical and managerial staff when implementing a sustainable green initiative. And this is something that Isaac will share more about. So yeah, all of these projects have links to the national campaign, and I'm very grateful for the response of the project, as I've already started meeting with people from organizations in British Columbia, Alberta, Ontario, and Nova Scotia. And so I'm excited to continue meeting with more people who are interested in being a part of the national campaign and or volunteering their expertise to support the development of the work that we are doing, not just from these provinces, but also from our other 6 provinces. And I'm specifically looking to meet from those who are not listed here. So now I'll pass it over to you, who will provide some more concrete insight into how she is restructuring an initiative at HHS.
Thank you, Sandra. So my name is Yul Neva. I'm a master's student in behavior change at Radboud University, and I'm working at the Canadian Coalition for Green Healthcare on the Bring Your Own Bottle and Bag initiative with HHS as our pilot site. Next slide, please. The goal of this initiative is to encourage patients to bring their own bottle and bag for day surgeries. And I went to McMaster Children's Hospital to observe the implementation of this initiative and to identify possible areas for improvement. In the same day surgery department, approximately 30 surgeries are performed daily, and each patient receives 2 plastic bags for their belongings, 1 for their clothes and 1 for their shoes, which means that 60 plastic bags can be saved each day, which represents 1,800 plastic bags per month. Patients also receive paper cups, which is obviously better than plastic cups. One of the barriers identified is that patients' reusable bottles could pose contamination risks, and the hospitals obviously prioritize sanitation. So for this project, I decided to focus on reusable bags, and specifically how to encourage patients to bring their own bag to day surgery. Next slide, please. So as you may know, there are some consequences with the use of single-use plastic bags. One of them is that single-use plastic bags contribute to greenhouse gas emissions through their production, use, and disposal, which negatively impacts the environment. Secondly, discarded plastic bags can break down into microplastics, and these microplastics can have detrimental effects on human health through ingestion, inhalation, and dermal contact, potentially leading to respiratory problems, for example. Finally, single-use plastic bags also represent a financial cost for hospitals. Next slide, please. I did a literature study and I made up this process model. And here you can see that bringing your own bag to the hospital is an intentional behavior, and there are multiple factors that influence this intention. One of them is environmental concern. So if a person is highly concerned about environmental problems caused by plastic waste, they will have a more positive attitude towards bringing a reusable bag, which leads to a higher intention to bring one. Another factor that could influence the intention to bring a reusable bag is the awareness of the negative consequences of not bringing a reusable bag, which leads to a feeling of responsibility, to use one, which could activate personal norms towards bringing a reusable bag. And the last factor that could influence the intention is the perceived behavioral control, which refers to a person's perceived difficulty to perform a certain action, such as preparation time and efforts. The last factor to consider is forgetting. Sometimes intention doesn't translate into the behavior, which is known as the intention behavior gap. So patients, for example, may intend to bring a reusable bag, but they don't do so because they may forget. Next slide, please. So we designed an intervention with the aim of encouraging patients to bring their reusable bag for day surgeries, and it consists of a message plus a picture, which is added to the pre-surgery checklist patients receive, and will be pilot tested first. It looks something like this. So what do I bring to the hospital? Please bring a clean reusable grocery bag that is big enough for your clothes and fits in a small locker. This helps patients to know what kind of bag they should bring, and the picture serves as a visualization, and it aims to target the awareness of the consequences. So the number of patients who bring a reusable bag will be tracked so that to measure the impact of the initiative. Next slide, please. This project aims to support the United Nations Sustainable Development Goals. So 3, 12, 13, 14, 15, and 17. Next slide, please. This project also meets the strategies for implementation. So first of all, this project explores the impact of the message on the PDF pre-surgery checklist patients receive following the standardized workflow procedures, and the initiative aligns with the project pillars. I met with a couple of people. I met with Victoria, I met with Carolyn, who is the clinical manager at same day surgery at HHS. And I also had the opportunity to meet with the working group, which consists of nurses, booking clerk, and patient safety specialists. And lastly, the Bring Your Own Bottle project aligns with the organizational structure and pillars and supports the local and national implementation of this initiative. Thank you all for listening.
Hi, everybody. My name is Isaac Began, and I'm a third-year student in the Integrated Science program here at McMaster University. I also have the pleasure of being an intern on the Plastic Reduction Project with Sandra and the Canadian Coalition for Green Healthcare. Now, before this, I also worked as a volunteer with Peach, and I'm really excited to have the opportunity to work on this project where we'll be focusing on aligning perspectives on plastic reduction strategies in healthcare settings. So when healthcare leaders implement or engage with sustainable initiatives in the workplace, there are a wide array of challenges that could arise. This can include challenges with the actual project itself, like whether it's feasible and practical, or larger institutional challenges. These barriers can have an adverse impact on the initiatives and can hinder overall change. As a result, our project is going to be exploring some of the barriers that healthcare leaders face when working to incorporate these sustainable changes. Now, we're going to be taking on this project from a national perspective to gain insight from healthcare leaders across the country so we can begin to understand their perspectives. We're also going to be looking at how these challenges differ between various healthcare leaders, specifically between managers and clinicians. We will then take these findings to develop a national framework that will equip leaders with the tools and strategies that they need to overcome these challenges. Now, the project rationale comes as a result of various conversations that we had with key stakeholders over the past couple of months. We engaged in consultations with various groups to learn more about the current state of sustainable projects in hospitals. We then went on site to Hamilton Health Sciences to hear about their perspectives and learn more about the experiences with different sustainable related projects directly from frontline staff. Reflecting on our conversations and experiences, we began to notice that there was often a communication gap between clinical staff and managers. This sometimes included a divergence in goals, values, or the practicality of some projects, which was impacting the effectiveness of various initiatives. We then took this information and began working on a plan for the project with the Canadian Coalition for Green Healthcare team. Now, we're currently working to understand this research gap in the context of a national framework. So, to accomplish our goal of learning about barriers that healthcare leaders face when implementing sustainable projects and whether a gap exists between hospital managers and clinicians, we're going to be striving to hear from over 1,000 voices of healthcare leaders across 10 different provinces to create one national paper and framework. Guiding our project are 3 key pillars. The first is sustainability, where we're going to be encouraging the creation and implementation of long-lasting and engaging projects in hospital settings that will be able to drive real and tangible changes in these places. Next, we have people, where we are going to be developing positive team dynamics and work environments. This will help bridge the gap between different leadership teams and align perspectives to create a more effective workplace. Finally, we have research, where we are planning to identify common barriers to inform national strategies that will enable individuals to overcome them. We've also developed a series of strategies to successfully implement this project. As one of our goals is to hear from those with lived experience in the field, we're going to focus on stakeholder engagement to foster effective relationships. Next, understanding that different groups of people learn in different ways, we're going to be working on developing tailored leadership strategies so everybody can feel included. Collaborating with others for our pilot projects will also ensure that our work continues to stay on target and on track. And finally, advocating for procedures that recognize and support sustainability initiatives will help to ensure long-term change. Thank you.
And so, yeah, this is where we are at today. And I think it's safe to summarize this presentation by saying that there's never a dull moment with the plastics reduction team. We are only 4 months into this project, and you'll actually just started last month. So we are rapidly growing in our impact and reach, which we're all very grateful for. And we're also very inspired by the work that's being done around us. So again, if you are someone who has an idea or wants to be a part of our project team or the broader national campaign that starts in year 2, I'd love to hear from you. All of our contact emails are on the screen. And then if you'd like even more details about the project, it can be found on our website, which is greenhealthcare.ca/plastics. And we also have our social media, where you can find us on the Canadian Coalition for Green Healthcare. So thank you all for attending and for listening. And now we're open to any questions. Thank you for the applause. Okay, so I guess there are questions that are in the chat. I can just go in order. So the first question, yes, this meeting is being recorded and it will be posted. It will also be sent directly to all of you who have registered. And thank you, Fiona, for sharing the details of the scope 1, 2, and 3. So the first question of, were endoscopy vendors supportive of tap water use? So this is a question that we are exploring. It depends on, from what I've heard and what I've been learning, is that it depends on the vendor. Some of them are not in favor of it because there is the concern that the lens could get scratched. And then there are some that don't necessarily have that concern. So that is something that is a part of our exploration phase, is to identify like who is concerned about that and are there ways around it, to be able to continue with this initiative. And so we're also speaking to the Canadian Association of Gastroenterologists and General Surgeons to be able to identify the best way to recommend this strategy.
Sandra, can I just add something to that as well?
Yeah.
And this has come up recently for us related to work we already had underway at HHS to advance the use of rebuilt devices within our perioperative services. What's really clear to us is that once we've kind of done all the checks and balance and figured out, does this actually work practically, it's really obvious to us now, based on some challenges that we've seen at the contract level with the rebuilt devices, that we have to do our triple check our contracts to make sure that there's no violation of the terms and conditions on those contracts. So what we wouldn't want to happen is that the vendor of, whatever device that's being used in endo specifies that it needs to be sterile water from a bottle and that they won't support the device or help maintain it or whatever. It violates the contract if we were to go to tap water. So those are really some simple things that we need to make sure we check. And those learnings that we're having along the way are really valuable when it gets to making this a national project, because that's going to be a challenge that everyone has. HHS won't be unique in that. And of course, we have group purchasing, but we also have direct purchasing as well. So that has to be done at both levels. And how do you navigate those conversations with your group purchasing organization, as well as with your own internal procurement teams? And if you have to check that twice just to make sure, like, your group purchasing agent gave you the green light, but internally, can we still support it, right? And that's a really important piece of this as well.
Yeah, definitely. And I'll also pass this question on to you, Victoria, from Michelle, who says that I'm very interested in hearing how we get around the manufacturer recommendations for single-use plastics.
Michelle, would you be able to elaborate a little bit on that? When I was reading it, I wasn't sure if it was about, that contract level language that you were talking about, or if it was something else. Maybe we can come back to it, Michelle, if you're still on.
Yeah. Okay. She just said, for example, ventilator circuits are supposed to be changed weekly.
Oh, I see. Yeah. So there again, if it's specified in the contract and that's a terms of your agreement with that vendor, you have to adhere to that. But when that contract comes up for renewal, those are the things that building that capacity and knowledge with your procurement team, whether it's your HHS procurement team or with your group purchasing agent, to say, this is something we want to earmark for discussion at that contract level. That's how you would have to navigate it. So again, you'd have to think, like, how long are we in this contract? How much longer do we have for negotiations? Is this vital to, is there a workaround from a contract level? And it might not be there, right? It might just be the vendor saying that that's what they prefer, when there's nothing that they can go back to in the terms and conditions of their contract. So again, we'd have to look at it at that level.
Okay. So there is a question in the Q&A that says, this is from Andrew, to reduce single-use plastics in hospitals through improved procurement. How does the HHS team find clinically equivalent products that are more sustainable and cost-effective than existing products that are being produced?
We currently do that now. It is, there's no formal process. There are vendors that will approach us directly and then we evaluate them. But part of the work we're doing internally here is to establish clear procurement policies as well around this, and finding a way to evaluate in a meaningful way the RFP through the RFP process, to actually evaluate how sustainable a product actually is. You know, for an example, I had something cross my desk recently that was forwarded to me from infection control. There was a desire to evaluate single-use curtains, or disposable curtains, not single use, but disposable curtains. And the vendor there was advocating that this was a very green product. And, you know, that's based on what the vendor was saying, it was very clearly greenwashing. So I had to do a lot of education with our infection control team to say this is something that we need to look at and evaluate when we're evaluating the product. Because again, the environmental lens isn't the only thing we're applying here. We have to make sure we adhere to patient safety and best practice and all of those other things that are really important to our values as an organization. But we need to raise the awareness and start to include that as something when we do a product evaluation, that the environmental benefit is, or the environmental impact is now just as important, or it has a level of importance that we need to look at in that product evaluation. So that process isn't in place yet. That's something that we're working on getting in place. Right now, it comes to me because we have folks in procurement that know that I can kind of apply this when we're doing a new product evaluation.
Yeah. And I guess just building on that, Victoria, have you engaged with your procurement department about making purchasing choices that would minimize single-use plastics?
Yeah, absolutely. So starting last year, we sent notice to all of our vendors that they needed to do an attestation based on certain criteria of where they stood. And that was to allow us to get some sort of baseline level of information about where the vendors that we directly work with, not the vendors that we do our group purchasing with, to say, like, where are they at now? And then it will give us a point of reference to, I guess, know how far we have to go. We have also trialed some RFP scoring language as well. That was an onerous task. I myself did the scoring on one contract and it took me 8 hours just to score the environmental criteria. And so that was a really clear learning that that's not going to be effective when we try to apply this out to all RFPs. So we have to find more efficient ways to do this and screen out vendors as well and the products that they're offering.
Definitely. And the last question that I see in the Q&A section is there a tentative launch date to the national campaign? So there is no specific date at the moment, but the way that we are progressing is looking like closer to the mid or end of this year, so 2025. And a new question says, do you have any data on plastic waste created by community clinics? I work in a family practice and am interested in being involved. So I can start. I don't know, Victoria, if you have anything, but right now we've just been focused on hospitals, specifically the hospitals that are a part of Hamilton Health Sciences. So right now, no, I don't have any data for family practices or smaller community clinics, but it is something that I think is very valuable to have, especially for the national campaign, because not all hospitals are as huge as Hamilton Health Sciences hospitals are. So having that kind of information would definitely be an asset. So yeah, I think I believe those are all the questions that I can see. If there is anything else, I'd love to know, but otherwise, yeah, thank you everyone for attending and for being a part of this project. And I have already been meeting so many of you. Have recognized a lot of the names in the participant list. So I look forward to meeting even more people and really appreciate all the support on this project. And I look forward to continue growing and making an impact with our team and everyone else who will join us in the future. So thank you again.
Thanks, everyone.